Let me say that again because it's so hard to believe. Psychedelic psychotherapy is here now, today, right? So I'm talking about cannabis, the plant that we all tried in high school and is incredibly common and legal now. Used in a particular way, in the right setting with therapists that have special training, that know what they're doing, cannabis is a legitimate psychedelic medicine that we can use in therapy to create deep healing, right? So I know this is hard to believe, just because it's cannabis, right? And I'm telling you, you've never seen it used this way before, and you would be shocked that it can be just as powerful and therapeutically helpful as other psychedelics that are being tested today. Okay, so I'm going to ask you to let go of your preconceived ideas about this plant because almost no one has seen its full therapeutic potential. We're not just talking about temporary symptom relief. We're not talking about using cannabis and you feel less anxious, less fearful, less depressed, or you sleep better. This is called symptom management, and it works well for a lot of people without a lot of the horrible side effects that we see with other medications, right? But the problem with this is that you have to keep taking it to manage your symptoms, otherwise your symptoms come back, right? So, and in this way, it becomes like any other psychiatric drug. If you stop taking it, the anxiety, the depression, sleeplessness, other symptoms will return. And this is because those symptoms never went away in the first place, right? They were just being masked by the cannabis, like pain medication hides the symptoms of a bad back or a headache, right? So what we're talking about is you actually using cannabis during a therapy session to get your controlling, your conscious, rational mind out of the way, which allows us to take a deep dive and work with your core programming. Cannabis allows us to work directly with your subconscious mind. It allows the client to have more clear access to emotions, to body sensations, to hidden memories, and the ability to process all of these things, right? So ultimately, this allows us to address the root cause of your symptoms and not just help you manage your symptoms better, right? So let me be clear about one thing here. It's something that we're seeing in all the clinical research with psychedelic medicines that absolutely applies here, right? So it's not the drug that is creating the healing response. Lots of people use psychedelics recreationally. People use cannabis recreationally all the time. It's the drug combined with psychotherapy. It's the drug plus a guided therapeutic human process that creates the results we've been seeing. I can tell you that not any therapy is going to work well with cannabis. Talk therapy, for instance, or cognitive behavioral therapy. This is the most common form of therapy, and it doesn't work very well with cannabis and with the altered state of consciousness created by cannabis and other psychedelic medicines. Cannabis sessions are not about developing greater insight or more understanding. They're not talking focused. They are experience focused. So, you can't talk your way out of anxiety. You can't talk your way out of depression or trauma symptoms. And what psychedelics and cannabis do is that they provide a powerful experience that we can use to, we can guide to resolve symptoms, right? So you are more than welcome to contact us at one of the Innate Path clinics if you're interested in receiving this treatment, if you're interested in psychedelic psychotherapy. But I actually want to invite you to learn more about this movement, about what these medicines combined with psychotherapy can actually do. So whether you decide to go down this path or not with us, we think this information is going to be useful for you. Right? So we publish video content like this on the Innate Path website, or you can join us on our Facebook Live discussions that we hold every week and ask us questions directly. You can interact with us directly there. Our goal here as therapists is to help individuals, by which I mean adults, young people, teens, families, and ultimately our entire culture, live a more sane, loving, connected life on this planet. And we couldn't be more excited about how medicines like cannabis are helping us achieve that goal. So thank you for your time, your attention, and take care.